Hi class, welcome to the end of the semester. You're looking at Module 14, which is helping families flourish, looking ahead, seeing what we can do to improve families. As with all sociology, we really need to explore the reason that we study these items like family or anything else, social problems. The reason is we want to make a change. We want to make things better. So as you review this chapter, you're going to find out about some of the products that are in place and what can help you within that process of better serving families as you're working with them. All of us will be faced someday with being around families or exploring them and servicing them, no matter what your discipline is. So let's look at these fairly quickly. What do families need to flourish? Well, I think we've already seen that they need to be faced with a fairly calm life, with good jobs, with good functioning homes, with support, with good health that would come into place. And so we learn together that families are resilient, very resilient. They go through ups and downs and they survive very strongly despite adversity, and they learn to come forward with it. And that even with ethnic and racial differences and gender issues, families flourish and they still are part of our society. So, as we explore this, what makes people flourish more than others? Um, there's those things such as positive self-concepts, the sociability, the intelligence, the scholastic competence that come into effect that help families flourish. Families' characteristics shape how families endure and how they face risk factors and how they react to those and how they recover from a major crisis, a death in the family, a loss of a job, how they move forward. All of these things are part of the factors that come into place. But when we look at this, we have to remember the community factors as well. The social networks, the interfaith building, the support of the church, the support of the school system, and what helps families survive. So let's look at this. Benefits for families. How do we help them get through? There are select programs that only select people are eligible for. People who have contributed to the system, people that are available to it, people who have the right qualifications for county or state or national level. And so there are programs that help serve people that are means tested. In other words, they need to meet an eligibility requirement. They need to meet that poverty level guideline that we may have talked about before, or that you went over in intro class, or you've looked at in another class. So, can I get services? Yes. Say I'm living in Tioga County and I have dating violence issues. I can go to Haven because I live in Tioga County. And there's that outreach available. That's a select program. But a means tested program is going to say you've got to meet our criteria because we get funding to support us to be here and we can't service you. Now, there are other programs like the Universal Approach, programs that help strengthen family without this eligibility requirement. And then there are tax systems under which those who earn more pay at a higher percentage. So we can have this variated scale, this variance scale based related to counseling and help for the family. So, lots of things coming into place as we start building this resilience of family. National health care insurance has gone into effect. It requires that in every state you have to have access to health care insurance. Now, states look at this very differently. Remember when we talked about marriage, that it's a state item, yet the federal government has stepped in with some of the things related to that, but it's still the state level that determines how old you are when you can get married. Healthcare has been a state level issue. And so states like New York offer more services and more healthcare systems than states like Pennsylvania. So there is a difference. But it is mandated now that everyone have national health insurance. So what that's done is drop the number of people without health insurance to less than 10% of the population, providing a better chance for people to get by and support that family issue. Now, other national programs in place are the Maternity and Family Leave Act. This was signed under the Clinton administration to guarantee that you could not lose your job if you were needing to care for a family member. So this includes the birth of a child, it includes caring for a disabled child, caring for an older parent that may have serious health issues. A lot of problems with this particular act. Better than what we had before. There is no guaranteed pay that comes with this, which is problematic. And employers can go around the fact and discharge employees for other reasons, even though they may be protected under this. There's also a strong fear in the population to apply for family leave or put that in place because then you've labeled yourself as that to your employer, which could lessen your chance to move up the ladder. And in the United States, we take less vacation time than any other nation, first world nation. And we're more worried about our jobs, and we live our jobs every day of our life for fear of losing them. You can see how registering for family leave may be very difficult. Okay. Other things that help build families include work environments. We've been into the work environment and the problem with the work environment, how it's changed over time. But work environments, especially who have policies of flex time, flex place as far as people working at home and working in the office back and forth. Think about it in a blended course. And for those of you, you're taking this as an online course, think how much education has turned to flex time so that you can take this class on the hours that work for you, that we're not meeting in a classroom, nor are we meeting online together. As you start exploring this, yet you're still having the interaction. So workplaces have changed, and we've also included telecommuting. That's the flexibility of the location of work from home, but also work while travel. Other policies that are really important for the family is a living wage. Think of that person with multiple minimum wage jobs and they still can't make it by to support their family. That there's policies that we are trying to get into place related to a living wage. And then the earned income tax credit, which allows that refund of federal tax credit for low-income families and reduces the amount of tax they pay. And then there's the typical programs we think of, TANF, Temporary Assistance for Needy Family. So if we're out of work or not able to make it by, there is some principal cash amount through welfare. Again, a qualifier program. Remember the difference between entitlement programs where we give money to that and we will get it back, like Social Security, versus welfare programs that are income-based, needs-based in the process. There are early intervention programs like Head Start that come into place and help children improve, but there are also early intervention programs that are mandated under school law that help people with children with disability that parents don't even know that they can tap into from the very time that they realize what that child's disability is. We see the state health insurance programs, which have been incorporated in that national health care plan. Remember, our text is a little old here, so they come into place, and we see the national health care policies. And child support. Actually, very interesting things. Again, child support is state controlled, but as someone is standing out there with high levels of child support due, their federal tax return is not returned to them, it's given for child support in the process to cover that debt first. So we have these policies in place to protect children. I think as you explore this, you really are starting to see how much we need to do for families that isn't there and what you've learned throughout this course. Is it right or wrong? That what's going on, and research helps show us that, and you've done that through your research paper, but we also know that in your research paper you were asked to solve the problem. Solving the problems means, how do we get government to give more funding? How do we get more support for the family? How do we get more community support and involvement to strengthen the American family system? These are all things I leave for you to think about and for you to initiate as you go into your work environments, as you explore your time as a teacher, a social worker, or a criminal justice person. You're all going to be working in these particular areas. And what do we need to do to improve the services and support these families at a level? What research do we need to explore, and what do we need to understand better? Let me flick back to your uh, module here. And so your assignment this week is to view the PowerPoints, which we've gone over very fast, enter the discussion board, which I haven't put the links to yet. And because my in-class uh, students were having problems with quizzes, I've added an additional quiz to this available to you. But remember, you only have to complete 10, and I will take the top 10 scores to determine what your grade is. It's been a great class to listen to your discussion boards or to read your discussion boards and watch your interactions. And I appreciate your time. And as you spend time in the class, I hope that as you've taken an online course, you've used it to the full advantage. Some of you have spent more time in the class than others. But I'm hoping that you've pulled out of this the core values and understanding that the social world and the influence of the social world on family is very powerful, and they are a significant organization within the process. Thanks, and have a great day.